Hi guys, this is Dutra. Thank you guys so much for supporting my channel. You know this channel is all about me trying to prove that I was medically gaslighted, lied to, denied for a qualifying surgical procedure, and denied the standard of care. I was also Frankensteined and medically jumped. My rights for surgical decision making was taken away. I was butchered with a non consensual experimental surgery guaranteed to fail, and I was denied the proper and true diagnosis post surgery and before. And the company and the employees involved, they failed to report to me, but also to JACO or HIPAA, to the reporting agencies, and they also failed to treat. As a Black American woman, an FBA, we are the most hated. Why that is, I don't understand. As you know, there's disparities in healthcare, disparities of the total knee, and I am just trying to prove with my limited education, and hopefully, and I'm still waiting for someone to refute my discoveries of the perfect crime. So this is just a warning. And if I was incorrect about a lot of this stuff, I think by now I would have gotten like a letter of defamation. I don't think cease and desist would apply to me, but I could be wrong about that. But I haven't gotten anything. Everything I've gotten, I've showed you. So, guys, I'm only going to try to take up like less than 10 minutes of your time. So, this right here, I'm just going to go back to something that I already showed you guys. This right here is from physical therapy, and this is 2/20/2019. And for those who are new to the channel and just knowing about me, hearing about me, yes, I was medically jumped in 2018, November of 2018, but I didn't find out to this till after COVID. No one would help me, so I had to do all the investigational legwork myself. So right here, I'm just going back to this where I showed you from physical therapy, where I was complaining. It says patient reports discomfort of posterior knee joint has worsened. 5 out of 10. And then down here it says that I'm having left gastroc, proximal, and so I looked that up, and it said it's the back of the leg muscle, and that was on 2/20/2019. Right here on 2/27/19, right here, this is from the physical therapist, and it says patient reports feeling some relief posteriorly in the knee joint gastric. However, she did need to walk a few blocks in high winds, which caused some increased pain medially and laterally. Guys, they didn't even fix my leg well enough to that I could walk properly. And I'm sorry, I said this is by the physical therapist. It's actually by the physical therapist assistant. This one right here is from the physical therapist, and this is on 3/6. And right here is this is my discharge note. So right here it just says this patient is doing better with no major episodes of knee instability. She will continue going to the gym, doing safe. And I highlighted safe because Dr. Brian Edkins told me to go to the gym and let loose. Don't hold back. That's what he told me. And physical therapy changed it and said, don't do that. Your leg's not strong enough. Exercises, and he wrote disgust. because what I just said, that's what we discussed. And it says, I don't know what that is, the HEP. So anyway, I was discharged. So this down here is 3/22. This is the date that I want to talk about. And on here, this was my old PCP. And I was complaining of elbow pain, back pain, knee pain. Because remember, guys, if you can't walk, right, you know, your back's going to hurt. You know, you have to do proper body mechanics. So right here, because I just explained that, I'm going to go to the confessions. I know I have not reported on the confessions, but I do want to address one thing regarding what I just wrote, what I just read. All right, so I'm just going to read this whole paragraph, and it just says, so this is page number 3, and it says, was taken to avoid over resectioning. So I didn't read the first part because it's on another page. It says the oscillating saw was used to perform a transverse resection with a meticulous protection of surrounding the soft tissue structure. The tibial biscuit was removed and had typical changes of anterior medial osteoarthritis with anterior to central wear pattern. The medial meniscus was excised, which means taken out. The MCL was palpated and noted to be fairly thin and narrow. That's the MCL, guys. Remember your ligaments in your knee, your four major, the LCL, the MCL, which stops your knee from going from side to side. And then you have the PCL and the ACL that stops the knee from going back and forth. So the MCL was palpated and noted to be fairly thin, narrow, but functional. That's very important. There was a rent in the surgical world in medicine means a large tear in the posterior medial capsule from the oscillating saw. I think they meant, and it said did not affect the MCL. So it says that I had a tear in my posterior. Posterior is the behind the knee, is the back. But they say that I had a tear in the posterior. So I asked about this, and because I was confused about this. So that is, when I looked it up, it said PCL. It kept coming to PCL. And I'm like, wait, that doesn't make sense because it's the back of the knee, but they're fixing the MCL, which is the side of the knee. So, and that's the medial, so the inside of the knee. So I'm just like, that's confusing. So I had to ask about that. And yeah, that was posterior. With the Ethibond suture. Now notice that the rent is in quotation marks. And I just want to address right here where it says Ethibond suture. They were very detailed about what type of suture it was because there's multiple suture types. And Ethibond is a non-absorbent suture. So as you guys know, that when you put something in the body, it's a foreign object. So your body can reject it. So I believe that's part of the problem with my knee, because when I had my 2019 revision, the surgery, pathology came back saying that I had black stuff, that I had a reaction to something. I think I had a reaction to the Ethibond suture because they put it in my MCL, which doesn't make any sense because my MCL was intact. If you remember on the MRI that they gave me, my MCL was intact, and my surgeons for my they said that a suture would make it weak. So I'm going to end it here because I have to do less than 10 minutes, and I will pick up in another video. Thank you, guys.